the shared mission of improving our community. It makes me feel good about what I do.
Working here means that there are so many additional layers of complexity that other hospitals don't have to deal with. And so, you have this certain experience that not a lot of other people have.
I think that there's a lot of things that we get right. They would ask, hey, what are your future, career plans? And I would tell them, I, think I would want to stay here.
Very early on point in my training, I came across JPS because I was looking for a place where I could get a very broad spectrum of training and serve an underserved population.
I did an audition rotation here with my husband, and we absolutely loved JPS. We loved the residency, we loved the culture of the hospital, and we fell in love with Fort Worth, and so it was kind of a no-brainer for us.
I knew I was going to get a good training in family medicine here. Came to love the institution as well as my colleagues, co-residents. We all bonded a lot through the years.
We definitely talked about it as residents also. We all found the idea of staying very interesting and exciting, and we wanted to make it happen.
We often get viewed as the place of last resort where people come whenever they're at the end of the line or they're in a major trauma or something like that. I think what people don't realize is that we're, full service providing healthcare and more trying to engage the community and try and prevent people from getting to that end of the line.
I hear pretty regularly now how patients are really pleased with their care and how they feel like they get top quality, top-notch care. And I do hear them say, years and years ago, you would dare go to JPS for your care, but they feel like they get really excellent care, which is always gratifying for me because that's kind of one of the things I wanted to do.
I had a patient the other day actually who had kind of fallen through the cracks and was no longer getting treatment for any of her many chronic diseases. She called me up one day and said, hey, you've been calling me for months. Why do you keep calling me? And I told her what I was trying to do, and she finally agreed to meet with me. And after our first meeting, I said it was nice to see you today, and she stopped me and said it was nice to be seen and not viewed, and gave me a hug. And since then she's re-engaged with treatment and has been really just a model patient.
You never know, the thing that you say today or the thing that you say tomorrow, how that may change somebody. To keep in mind that philosophy, so that way everything you do every day, you're seeking to make an impact in someone's life instead of seeing as this is the one moment that I have with this patient. I think any small gesture, any small thing you do can sway the pendulum one way or the other.
Everyone deserves a competent healthcare system, and I absolutely feel that JPS provides that for our patients, whether they are paying or not paying, or whether they are, documented or undocumented. They all deserve someone who can help them achieve health, and I think JPS is providing that. I'm proud to work here.
As a resident, it was already an honor to say I trained at JPS, we saw a lot of crazy stuff. We did things that not many other residents, especially in family programs, got to do. But now to be able to say I work at this great hospital, it's level 1 trauma center, it has a great residency program attached to it. I think it's a huge honor, and if anything, it kind of gives you motivation to keep that momentum going of being progressive, of trying to innovate, of constantly trying to improve not only the hospital and the different divisions within the hospital, but the residency as well. So I think, I would see it as motivation to keep up the hard work.
I really feel privileged. I mean, I have a great job that's intellectually interesting. There are some challenging parts about it, but I feel privileged.
Really does feel like I'm living the dream.